Well, health equity is an opportunity for everyone to have access to greater health, right? And greater health doesn't mean just going to the doctor's office annually or getting to the dentist. It means having access to workforce. It means having access to housing needs, food. It means everything, addressing the whole human.
For us, health equity, when we think about it in relation to place and race, we know that there's certain neighborhoods that are highly resourced. There are other neighborhoods that are under-resourced. And unfortunately, and it's not surprising, those neighborhoods that are under-resourced oftentimes are neighborhoods with low-income residents, with communities of color, and they're often left out of planning processes to advocate for a healthy neighborhood.
Bad policies have created bad and poor health outcomes for so many people, and particularly marginalized communities and communities of color experiencing systemic oppression.
We three partners all had the same goal in mind: reduce health equity issues, improve the safe housing access, reduce asthma exposures, and also reduce lead poisoning exposures. But a second piece of it I think that was really prime was taking the power outside of the traditional local government running these projects and having it put in place of a nonprofit and advocacy group and having them be the community engagement driver.
It needs to be communities telling us what they need to advance health equity in their local communities, what resources they need, what partnerships they need, and philanthropy saying, yes, we can support this, and you tell us how you want to do that work, and trusting communities to know the solutions that they need to support health equity, and let communities do the work that they know needs to be done.
Being a member, it not only empowered our voices, and we learned how to use them, learned how to articulate the things that we need for our community, but we also knew that we weren't alone, right? Just being a resident, being a homeowner in that area, you know that there are shared concerns. And you know how to elevate those concerns.
They also need support as they navigate this transformational work. Building trust, building relationships, changing the way that your community functions is really hard and it's long term. The transformational change that happens is unbelievable, and it's compelling, and it shows us that there is a better way to create health in the US.
And we have seen very positive health impacts, of course, but we've seen all kinds of things in our community really get better with these diverse voices being listened to and being given the power to express what they say the problems and barriers are. Those are what the problems and barriers are, what the community says they are, not what somebody else that's outside of the community thinks they are.
Build has provided us the opportunity to really support a team of resident healthy housing champions to, one, support their leadership and advocacy capacity to deepen their understanding of the role their voice can play in advocating for healthier neighborhoods. No one should have to live in a neighborhood that's under-resourced. Everyone should have access to a healthy neighborhood that's highly resourced.